So we all know about the healthcare challenges in Nigeria today, from the grassroots level to state level, federal level. Today we are looking at how those challenges can be addressed. And one foundation in Nigeria that has been coming forth in addressing those challenges of providing advocacy for health and wellness is BIGAiD Foundation. Taking it one step at a time with one goal of ensuring health for all in Nigeria. So today we'll be looking at how approaches to health really at the grassroots level, local government, state level, federal level, those structures that are in place to ensure that healthcare system is improving in Nigeria, how efficient they are, and all of that. And with me here today are Dr. Roy, a medical practitioner. We have been Sonia, an environmentalist and health and wellness conscious person. And we have MC Papi, who is said to be the voice of the masses.
Poor masses. I'm on that.
Poor masses. So yes, let me start with you, MC Papi, since you are the voice of the poor masses.
Yeah.
The masses are said to be at the receiving end of health challenges in Nigeria. I usually don't like to say poor masses, but I like to say masses.
Okay.
Because both the rich and poor are all masses. So what is your approach? What is your mindset about the situation on ground with the masses?
You mentioned two things. You said local level,
Yes.
and structure. While you they talk,
yes.
you mentioned these two things.
Yes.
Local level,
State and federal.
Forget about the state and federal. You say local government, and you can't talk about structure.
Yes.
Now the two things will be a problem for this our country in the healthcare system. First of all, the poor people, they are the receiving end when it comes to health insurance in this country, or the healthcare system, how you want to call them. Now, the poor people, which is the local government, now them be the people where the government supposed to even pay more attention to, and now them the government they neglect, both for every aspect of their life. Now let's go face the healthcare system with the poor masses. When a poor man gets health challenge, enter hospital, just know say he go die because of the negligence where they face for hospital. If a poor man dey sick, enter hospital, first of all, the way the nurse go take attend to you first, e go be like say you commit crime to become a poor man. As you enter hospital, abeg, you no see people here. Person carry emergency come, you dey tell am say abeg, you no see people here. Nurse, you go enter hospital, you carry better sickness come, nurse go leave you dey chop rice, saying dey eat make you wait. Person get emergency, negligence. If big man enter hospital, they go dey run up and down to make sure say they save him life. So e mean say big man life dey important. Life now if you segregate life, big man life you go put attention, poor man life you don't send them. The system, the healthcare system for Nigeria no protect poor man. If you be poor man, you know well, government no fit, you go just die. If a poor man get kidney disease now, there's no structure there to protect that poor man. Say they go do kidney transplant for them. You don't get money buy kidney, just forget that you don't die. Or say you don't get people go fit put your poster online, say I bet help am see account number.
They don't sell kidney.
It doesn't. You don't need to sell kidney. You don't need to.
No, they donate.
They donate kidney. The poor man go fit access that donation.
And your loved one can actually donate for
Forget
you.
about your loved one. What if say
Exactly.
a poor man no get loved one?
So
a poor man no get loved one because so you no get kidney.
Where go get them?
So you mean say the government no get any structure
No, you don't
in
buy
place?
in the world. There's nowhere where you go meet person to buy kidney. Give yourself.
Why not even the kidney will be the matter?
No, I just want quick
Poor
correct that
man
part.
no get access to better healthcare
We will address
system.
that one. I just want quick correct that part.
Yes, but I understand, Papi, from where you're coming from. But you see, one thing is for the government to have a structure in place. And another thing is for the so-called poor man to understand, to be conscious about their health. To know that, I need to eat this, I need to eat that to protect myself from doing X, Y, Z.
Excuse me, uncle. See, you are going to bring your worry woman in me out. You cannot say health crisis is not planned. We largely need to be largely responsible for our health, move around, eat right. The eat right matter. So now we talk just now. you think a poor man can spend 150,000 naira for food in a month?
You don't have to spend 150,000 naira.
No, they have the knowledge. Look, these things are divided. There is, like, according to him, there is the role of the government. Now there is the role of the masses.
Individuals,
There
yes.
is the role of the healthcare workers. Right? I will take care of myself. But okay, what about accidents? Who they plan on?
Oh.
Somebody comes to the hospital in an emergency. Let's leave NHIS. Let's even talk about administration. Even in a crappy hospital, without checking if the person is hypertensive or diabetic, they put saline or dextrose or glucose or whatever in his body, and then they move from a state of small health crisis to coma or stroke, simply because obviously we don't even get, according to the system you're saying, there is no health record or no data collection.
I agree.
That one now not be money. That one not be say they not bring money. But these things are in private hospitals. The government establishes a government or a public hospital in a place. There are small stipends they collect. Whether the government is sending money in there or not, the management of that place should be able to get some things to work. You are having a surgery and the light go. Patients go they donate money for fuel.
Okay.
So the thing is messy.
Okay, quickly, I want to quickly address the problems so that it's not like we're just talking.
Yes.
scattered.
You're a
Yes, thank
doctor.
you. We're just speaking for the masses.
Yeah, we're speaking, but if we want to look at the problems, right, let me start with something. Illiteracy is a disease. And illiteracy is more connected to the poor. That's where I want to start from. So that I want us to have a clear mind, not a biased mind of, it's always the poor. Sometimes that illiteracy is what kills them. There's a triad of medicine called poverty, ignorance, and disease. They work together. Once you're poor, you're most likely ignorant because you don't have access to information. And the moment you don't have information, my friend, the disease is knocking on your door. So poverty, disease, and ignorance is a triad that works together.
You did hear?
However, I would not also, there are lapses everywhere, even in the healthcare system, all right? Yeah. First of all, have we ever addressed the manpower? We know there's a Japa syndrome. Doctors are living here every day. There's a standard. There's a standard of doctors to a number of patients all over the world. You don't have enough doctors all over the world. And there's a number, WHO standard, there's a number of a doctor to amount of patients. If I tell you for Nigeria, I was doing the calculation with one doctor to over
1,000.
Over 4,000 people.
Yeah, okay.
We don't have up to 60,000 practicing medical doctors in Nigeria. And our population is going to 200 million. Do the rough maths in your head. One doctor to about 4,000 plus patients. And it's very easy for you to come to the hospital and say, doctor is not available. Doctor is not available.
Doctor, we're talking about the doctors that are available. The negligence of those ones that are available, which is what...
address that word, negligence. Bam. Is a word that if they bring in a patient dead, we call it BID. They will say it's doctor's negligence. I'm telling you. And he kept on saying, the rich man, the poor man. Let me even tell you, because of how bad the system is. I've seen a rich man come to the hospital and there was no oxygen. He died. Is he not a rich man?
Yes.
So those are
like rare cases.
So where I'm coming from is it's beyond looking at it from the poor masses. It's all about poor masses and all that. Again, there are, I don't want to call hospitals, but there are expensive hospitals in Abuja here, or Nigeria in general. Hospitals that when you go, like to see a doctor, consultation is from 30,000-40,000 naira.
I know.
Do you understand? So let me even address that local government grassroots structure. I did my NYSC in Nasarawa State. I did my housemanship in State House. I needed to get that rural experience. So I would have gone to like good hospitals in Abuja to do my NYSC, but I went to Garaku village. Not because, what do they pay? Because I wanted to understand what the grassroots is when it comes to healthcare system. And if I tell you this thing, you will not believe. The government put more in those healthcare, in those grassroots, than those big national hospitals in Abuja. Maybe because, I'm telling you, I will tell you why. You see those small hospitals. That's why I'm using that Garaku as an example. That my hospital, I experience when they say save life. Like where they work now, it's a team structure where there's a consultant, there's a senior reg, there's a registrar, there's a medical officer. So before it happens to a patient, everybody will think about it. But I will tell you, in that place, we're just 3 doctors in a general hospital.
And you were serving.
Yes, I was one of the doctors.
Like you came out fresh from school and you
Yes,
were one of the major
I was
doctors.
one of the major doctors there. Like when we're in med school, they'll tell you that.
As a graduate, are you not supposed to
No,
be?
of course, you've done your housemanship. You're
You
good
spent
enough.
7 years for university. You never reach me, no
you don't-
TJ.
yeah,
No,
of
you've
course
done.
not.
You're good
Yeah.
enough.
You're good enough.
When I was in med school, they'll tell you that a time will come, you'll be the only doctor in a community or a village. I said, nah, lie. It's not possible. The first day I did my call, there's something we call retained placenta in a woman.
Yeah.
Like the cord that snapped, the placenta was inside. I did, only me for night. I never done before. I called my doctor on the phone and he was telling me how to do it. What am I trying to say? I will talk more about what I experienced in that hospital. Someone said something about accident just now.
Yeah.
She talk am.
In that hospital, on a Friday, there was not steady Friday because it's along the express from Abuja to, I think, Makurdi, Benue. You will just be staying like this. I'll just see road safety. They will just be coming. I already know what is happening. Bear in mind, I'm the only doctor around. When they come, this is going to scare a lot of you. When they come, they just bring in like maybe 6 people. So what I do at that point is I triage. Triage is 6 accident patients. I will look at, and I'm the only doctor,
Worst case.
and I don't have oxygen. I cannot take over respiration. There's something we call a tube. I can't even put tube. I don't have a laryngoscope. I can't do anything. So what do I do when I see 6 patients? I'm the only doctor. So that's where I'm trying to address the manpower part. And I see 6 patients. 2 gaps in for life. Like these guys, if it was in a developed country, we can take over respiration for those people, take them to the ICU. First of all, we don't even get ICU.
Why?
Because that's the part we are talking about. Because our government, because I will protect my people, our doctors.
I feel say una be the part of the problem.
I will
Because
protect
the
my
help money
people.
when they give, what
No.
let they follow the chop the money.
I will tell you where the problem
Because
is.
I feel say the government they release the money.
No.
When you say you protect
I
your
will protect
doctors,
my
are you
people.
saying you're protecting those that are negligent as well?
No, I'm protecting.
That's what he's doing.
I'm protecting the mindset we have about doctors of using that word negligence, even without understanding.
But
the
that
word.
is what
The
is
word-
happening
the
on a
word
daily basis
negligence,
now.
He said is the failure to care. Is the patient already in my care?
Yes, now.
It's not already in my
Patient
care.
dey una care.
No.
Patient dey una care. Una dey neglect am.
hold on.
You know,
Papi.
a problem of transportation. That's a problem you've not addressed.
Okay, fine. Hold up. Let's even break this thing down. Leave doctor. You people are supposed to be on the end line of this in a more civilized society. Imagine what he's saying. Civil, what do they call them? Road safety go carry 6 people when get accident. Obviously, the accident did not happen now. Well, maybe on their way down, they picked. After most now, vehicles are passing. People are crossing the express on foot. Are they road safety supposed to carry injured people? Hold up. In a standard society, because we're saying Nigeria is a developing country, these things are not
Underdeveloped.
developing. We don't open eye as a people. Leave the government part of it. I'm just saying that
third
this is
world country.
2023 and we have access to ambulance system.
Of course.
We don't have paramedics. I remember when I was in Benin, they have paramedics training on in UBTH.
Yeah.
People, what did you want to be when you were growing up? An average Nigerian wanted to be a doctor, massively.
I
But they were saying
didn't want to be a doctor.
Me, I be no one be
you've been
doctor.
fine.
No, if you
Congratulations.
know book small, neither
They
say you
won't
want
be
to
a
be
doctor. Oh, did I say they don't know? Sorry.
No, I wanted
But what I'm trying to
be a
say
lawyer.
is all these people,
and I read law.
people wanted to be doctors, but there was this thing that was going on. Like in Uniben, they'll say more than 120. You pass JAM, but when I pass 120. First of all, the scarcity is coming from the grassroots. Say, okay, access to education. People know book. People get the desire. When they say when I get limited numbers of people per class or per year for medicine, that is aside. Now,
Which is good.
Which is good.
I'll tell you why.
Fine. Number two, this is not, we have moved past the time where people were studying medicine for passion and love of humanity. Now access to JAPA. If you meet somebody who went to university, now make you forget better job abroad. Because you are saying, excuse me, you're just coming back from university to a government institution and there were just 2 doctors before you.
I was not coming back from the university.
You just a graduate.
I'd done my housemanship.
Fine. Okay,
That
you're
is
now
very
a professional
important.
doctor.
already.
Yeah.
But what I'm saying is, at the time of your coming, there were 2 of them. Suddenly you were there,
Make it
and now
3.
you are the only one that's mostly on ground because they don't get senior. That is the negligence he's
They
talking
don't
about.
get
no,
They
no,
don't talk to senior.
No,
They
what-
don't
no.
get new small limit.
No,
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 now.
You dey ground.
No,
Otherwise, how
no,
would you be the only one on
Make
ground?
the small go dey work, make they cheat.
No,
Go to the
no.
hospital and see what those senior matrons
No.
do. They don't leave their ass from
Na
their
them
seat.
wicked
Na
pass,
the-
those
the
senior
small
matron,
nurses, na
they don't
cheat
make
go up
effort.
You are
and down.
getting it wrong now. You are getting it wrong.
I'm talking from the space
wait,
of
wait,
experience.
first
When I
of
go to
all-
the hospital, this is what I see.
Wait now.
This is what everybody see.
It's okay to see that, but it's not a problem.
It's not okay to see that.
No, what's the problem? I have my license. What does it? Why would they give me a license?
Doctor,
If
you said
you are
there's
giving
a
me a
shortage.
license, wait, you're giving me a license and you're telling me I cannot treat people. I still need my seniors. You've given me a license. I said when I did my housemanship, it's not everything you see. It's a continuous learning process. It's a continuous in medicine. In medicine, let me tell you, in everything you do, what makes you a good doctor? To be honest, you will save life and life will go in your hands. What makes you a good doctor is the net. So in 100 lives, everywhere in the world, there's not everywhere in the world. In 100 lives, if 100 people comes to you, how many did you kill and how many did you save? Is what makes you a good doctor.
Have you asked you one question?
Yes, tell me.
This is
Nigerian
the
doctors value life.
100%.
No, of course.
100%.
Well, no,
Let
I
me
know
tell
why
you.
they
Let
ask
me
now.
tell you. Do you know why I will tell you I value life?
Why I ask you now? I know why they ask that thing. Nigerian doctor, which one have value pass money?
How much do they pay us?
Wait first now.
Life, of course.
Okay, but that one na between una and government.
Life.
How much they pay
Life,
una?
no, life.
Life. And why be say person go reach hospital? Doctor will tell am say they no fit touch her if you no bring
pay
money.
money.
Let me tell you first of all.
So if life dey important, why you no save the life first? Then
wait,
dey fight for the
Let
money
him answer
later.
that question. Let me
the
answer that.
question you
Let him
asked.
answer that
First
question.
of all, a doctor will not tell you to go and bring money. Number two, there's
government don't say
wait,
we
wait,
not.
wait,
In
wait,
government
wait, wait.
hospital.
No, in
Hey.
government hospital,
Yes,
doctors.
they put and say in government hospital.
in government hospitals, you are even whatever you're paying is subsidized. It's subsidized. The only thing you buy are those reusables. Do you understand? They'll tell you, say, buy syringe, buy all those things.
Yeah.
Because of my experience in a government hospital, in a rural area, that's what I'm telling you all this thing. Your healthcare is subsidized there. I will talk about the National Health Insurance Scheme. I'm coming there. But I want to quickly address what you said. First of all, as a doctor in Nigeria, right? Guy, in the whole world, we are the least paid doctors. So I cannot value the stipends that they are paying me. Because my counterparts in a developed country, Baba,
Hence the
the
japa.
money they... No, of course, you can japa is a normal thing. Everybody's japa in all spheres of life in Nigeria.
Everybody
It's not just doctor. Everybody wants a
When a
good
doctor
life.
let the japa pass.
Yes, everybody wants a good life. I have a family I want to take care of. So I want to japa. I'm
Why
telling
you
you the
go
truth.
japa?
Why not
So,
go japa?
please,
If you're
please,
paying me
hold
well,
on.
will I stay?
Let's not make it seem look like we're attacking doctors.
Yeah,
Because
of course.
Let's go. Let's
You guys
cross
are
it
not
out.
attacking.
Let's spread it across. But the government has their role to. I have their role.
Let
to
me say
play.
we dey attack
But
doctors.
what I
Doctors
talk
get
be say
pride
now
for
they
this
work
Nigeria.
now they work for inside the thing. And let me tell you the
We
projection.
love our jobs.
The projection people give out is I don't give two shits about. When I had my appendix removed. I was rushed into worry on an emergency one Sunday afternoon. Now, I was told that there was no surgeon on ground. That the only surgeon that was on ground works in general hospital. They got that man for me in less than 2 hours. You want to tell me say that man no get surgery within the next how many hours? And I had complications from my surgery. I was there for over 3 hours. Appendix is not supposed to take time. But that man no get work for front. Why? Because of say, like you said, you cannot be a doctor and then now instead of actually living,
Was it
you are
private
surviving.
hospital?
I went to a private hospital.
Good.
They put somebody from a general hospital to come do my surgery.
How do you run a private hospital? With your money in your pocket? No, I need you to answer. How will I run a private hospital? Is it
So does that bring you back to the priority of people who can afford the healthcare that he's saying about the poor people?
Exactly. It's just like in life. Let me tell you, Baba, there's agege bread and there's next cash and carry. You go to agege bread and eat what you can afford. That's why you have small hospitals like all those, what's it called? Like I said, Garak, all those, they are national, they are general hospitals.
So if I
can go, you can't come to hospital like Nizami and Nisa Premier and expect that, guy.
Okay, do you hear what? So if I can afford next cash and carry, but next cash and carry is not available, but this company or this restaurant I want to eat can go get somebody's agege bread and package it for me like it's from next cash and carry. Is that fair?
No.
That's what you're saying.
No. I'm don't get my agege and next cash and carry different. What I'm talking about is services rendered, not the human rendering the services. I'm a doctor. Whether you are black, white, whether you are rich, poor, if I'm going to do appendix, I'm going to cut you, remove it, and stitch you. While I'm doing it, just like I'm a gynecologist, I'm doing cesarean section. The joy of a gynecologist is to see baby out, mother is fine, everybody is fine. So I won't say because this one does not have money, I will cut her zigzag. My signature
No,
is
but
there.
in your government hospital, if your affiliated private hospital calls you and say, "Guy, Alpha, we need you. We get 4
Then
people."
go
this time,"
ball out.
You will,
You go go.
you will outsource to your whether younger, older, whoever is on ground, and you will go for that.
Yes,
private one.
nah.
Why? Because the stipends, like you called it, is not enough, and that is from the government. What I'm saying
That
as
is where
doctors,
where
why
question
una
now
no dey
come in
push
now. Which
for-
one I
why
like
una no
pass
dey push
money
for
and big
first
life?
step?
Okay,
Why we not dey
doctor.
push? Okay.
Hold on, doctor. Papi asked a pertinent question. He said, what do you guys prefer the most? Is it money or
life.
life? Fine,
It's
you
life,
answered
of
life.
course.
So the
It's
question,
not-
which
it's not-
takes me to his second
it's not
question:
debatable.
why is it that when a patient is being brought to the hospital, either for accidental cases or
Police whatever, emergency.
gun injury or
All
wound,
those
on-
things.
first you ask for police report or whatever police permission to treat the person. Secondly, maybe the person doesn't have money, you guys kind of store the treatment. Why do those cases come up?
Let me address these things based on the hospitals
Yes.
and everything you said. First of all, for the gunshot, right? It was a law.
Okay.
Right? It was a law which recently I think they've removed. I think some weeks
Some
ago.
states, yes.
Yes. So it's a law. You follow the law. So that is not the doctor.
Even at the dying of the
That is
patient,
not- that's
doesn't
not-
matter.
you
The
know-
law
you
has
know,
to be
he
followed.
is-
Because
there's-
some people might be
See,
bleeding out and you're
see,
literally
save and
watching
handcuff
the
am.
Save him
person.
and handcuff him.
Save and handcuff am.
Who will handcuff him?
I don't know.
That's what-
Handcuff am and I save am
That's
now.
what I'm saying.
Hold on.
Um,
In developed societies that we're talking about, take for instance the United States. If there are cases like that, they save the person. We've seen movies where the person is being handcuffed
And
even
then-
after
They
surgery.
call
After
it
surgery.
the
So
person
you know,
is
so
dead.
why can't we have those kind of situations in Nigeria?
That's what I'm saying. First of all, there is a law that guides the land.
The doctors
now.
argue the law. They
Wait
do
now,
the government,
wait,
give the
wait.
government the reason.
That is why we are
Una
here.
dey give the government
Wait now,
reason
that is why we are
to
here.
say no, more save life.
Let
We
me-
love to save life.
Let me tell you,
Forget
behind
about
the
this
screen, that
Those
is
are the money they want
that
you
is
now.
what we've done. That now the government is seeing it like, I think we have to change this law.
Yeah, but why is it taking? Why did it
Why
take
did
you guys
it
so
take
many
long?
years to
No,
get
no,
that
no,
done?
It's not matter of
You
taking.
guys, doctors did not do it. Advocates did it.
That's
Yes.
why I
Speakers
said
in the
I
House
said
did it.
something.
No be
I
doctor
said-
do am.
I said,
Doctor lock
wait,
up.
wait, wait, wait. I
Revisit
said
this
I
thing.
said something. I said behind the screen. You don't know what we are doing.
Nothing that they do.
Wait,
Una
now,
lock
wait.
up for years.
No, behind the screen.
Na activists, na make this thing
No,
be
behind the
come out.
screen. Behind the screen. I don't want to call the name of my hospital, but I will tell you for a fact, yeah. I should call the name of my hospital.
No, they may have contributed
Let me
towards
tell
that,
you.
no doubt.
Let me tell you, Dr. Wada, yeah.
I know him.
Dr. Wada is not just is a good man. Let me make you understand. They've seen a lot of cases that a patient will come against the law, we will treat. There was one time, if you remember, I think we treated a patient. I think Gariki Hospital. They treated a gunshot patient. The doctor was facing, and I think Dino Melaye was one of the senators that were probing the doctors.
Why?
Because first of all, your law is not on. You will tell me that don't treat a patient if you don't have a police report because he might be a criminal.
So
I want to treat this
They don't even
patient.
treat criminal trial for inside
That's
jail
why,
well.
then the police go come. If police come with the patient, if police come with the patient and say this guy is a criminal, go ahead and treat this guy with handcuff. We will treat.
Hold up, doctor. So this
Una
is
supposed
this
to
is
get
like-
100%.
for na hospital.
I be police.
No, they're not supposed.
Me-
but
I
this
be
is-
police.
hold
May
up,
gang
hold
come
up.
beat me.
Anything to
This is
save
messing my
life.
head.
May gang come beat me.
MC
Anything to
Papi-
save
MC
life.
Papi-
Since for you to get handcuff, save that life. Since you get passion to save life,
Speaker,
get handcuff.
Speaker of the House.
Uh-uh.
Your hypertension will not get first aid kit for you in case you fall. But what I'm saying is this:
Yeah.
what you said now, you don't tie yourself and all of now for later.
tell me.
No, that's not my intention. We know that Nigerians, we don't have like a free toll system,
At all.
right? But what I've learned is, if you go to any, even a rural community, once you see a healthcare, police stations are not far away. Why una no go get access to call? See, if I bring, I may have even hit someone on a hit and run because I don't want to leave am for road. I carry am, put for front of hospital. Now you don't know what's going on. You want to tell me that nobody has the mindset, there's no connection, there's no link or whatever, or there's no system within your hospital to say, I'm going to call the nearest police station so that at least you're not supposed to get handcuff. And that police go bring handcuff. But the treatment, first aid is going on while there is access, while you make effort for the law to come find its way. I'm not trying to say, okay, the system has to be perfect. Even these developed countries, they have errors happen every now and then. But when a Nigerian doctor sits down and say this system is working as good as it can work at the moment, and it's not nice.
No, we're talking about saving life, and we're talking about killing matters. Go back to what? Who are you killing? Why do you guys always like to kill?
I want to kill. Before you kill the matter, I want to bring two scenarios.
No, sorry.
Hold on.
I want to end this matter.
Okay, end. I'll prefer you use the word end than kill. Thank you.
I don't think. First of all, when they bring the patient, who tells us is a criminal case?
So why do you people
wait
assume
now?
and not
Wait.
treat?
No. You said when they bring a patient and they say this is a gunshot or a criminal case. Who brings them and tells us that?
It could be anybody.
No. Now.
That's
That's what I'm going to. First of all, a police might bring them and say this is a criminal. Address this thing. I've seen a situation like that. When the police comes and say this guy is a criminal, treats this patient and will take over the patient. We do that. If another person brings this patient and say
straight bullets
and say maybe like 3-4 guys, looking somehow, I don't want to profile anybody, and they bring a patient and say this is a gunshot wound, treat this patient. What if they are gang members?
Does that give them? Does
Life
that give
no
you the
be
right
Do you
life.
understand?
to die?
Wait now. What if they are their gang members?
Life no be life.
Wait now. I don't have a backup. I don't have a history about these people.
Mm-hmm.
Do you understand? I don't know anything. I can't just jump into treating you without a police report. That is how this thing came about. I can't just jump ahead to treat you. I'm aiding and abetting you.
Doctor, you get work.
As I treat you,
They
finish.
treat you when you discharge them. Now why someone gonna call police station?
Like I said, they came with other people. Like, do you know how many times they come and beat up doctors? Doctors are running. Which police station you want to call?
Doctor,
police, before police come, they don't hang doctor leg.
Wait, never begin.
Just
They don't
what
deal
I'm
with you.
explaining is simple. I said
Warri,
you see a gunshot wound, a victim is brought to the hospital.
brought the
I'm coming.
patient?
Whether they are brought by people
Anybody
that look
fit
like
bring patients
smokers
now?
or drinkers or drug lords, I don't care. If somebody is brought to the hospital and the person has something as serious as a gunshot wound, what I'm saying is start to apply pressure, start to do what you want to do. Not be only you be the staff, we get errand staff. Somebody should call the police so that by the time you are done putting a band-aid.
Well, I suppose they won't get standby police line.
No, we leave that one. We leave that one say not there. But by the time they will use 1 hour or 30 minutes or 5 minutes, whatever, information should have gone out that we have a suspected criminal.
Exactly.
We are giving them first aid, but we need you to come down.
The case of this girl, wey enter one chance, wey dem stab her, no be gunshot o, dem stab the girl. They were literally begging the doctor, say abeg wanna treat this girl make she no die.
Carry you go there.
Na so they all dey do the girl anyhow. If you see like the doctor, you know what you go do one day.
He's
No, you
not
know
the
what
ostrich on it.
No, you
I
know
want
what
to
you go
pay
do
me.
one day, just wear cloth, pretend like say you just
They
know
sick
where.
when you see the attitude.
Then you as a doctor go say to your own fellow doctors and
They
nurses
do.
go do you.
You are saying it from
They
the
go
point of.
turn you with your blood, go dey throw away.
I understand where you're
They
coming
go
from.
neglect you.
You don't have enough manpower. There's a lot of work on you. It's a ratio of 5,000 patients to one doctor. We can empathize with you on that. So this is not our argument here is not against it. Just pent up anger against the system.
We don't get
But
problem
what I'm
with you
saying
as a
is,
person.
one of these days, when you are down with malaria, I know
Go,
don't
make
feel
you go
anything,
see.
or let your temperature just go up a bit. Go to a public hospital
And see.
and wait for. I even went to a private hospital. I don't want to call the name. I went to a private hospital last week when I was sick. I was literally passing out. They said, "Oh wait, go and do a test. 45 minutes. Let's know." I had to go back to meet the doctor. That can I get first aid? I can't stand. My joints are packing out. Then he said, "Okay." Later they found out that they said it was ulcer. I had a bacteria, whatever. I said, "Fine. This is my first time here. I came here on an emergency. You don't have my medical history. Can I know the name of the medicine you're prescribing so that I will run it by my doctor to know if based on my medical history that is safe for me?" They said they know they give person name.
You
that
don't see
and
am
pay.
now.
I had
You
that,
don't
so I
know
should
now,
take my
load,
test
you
and go and
don't-
give my
oh.
doctor. I said I understand. My doctor is not here, but what I'm saying is I will buy the medication if he says there's an alternative. Or let me hook you guys up on the phone. When we even leave doctor do this one, doctor not do that one. I made mention of data collection, data management. In the private hospitals, yes, these things are they are working on it. Another thing I think that we need to review for hospitals because of medical tourism, that's a big thing that we're going out for treatment, is they should ease off on the advertisement restriction, right? So they don't let private hospitals do certain adverts, medical adverts. But then it was when I was in that hospital I realized that they were big on renal treatments. they were doing laparoscopy and all that laser treatment for kidneys. We didn't know that. Fellow people, they said they can afford the treatment here, but they can't pay for flight tickets. It's why they can't go abroad. So those are things that can be fixed. Thirdly, look, I don't care about police at this moment because life too. I care about that, but we need to look for a way. Dial any emergency. If you call your social network customer care 121, it goes right. They should be able to do something like that for doctors. Because if I wake up tomorrow and I create an app or I create a platform where you can consult online, other doctors that practice on ground will say all these amateurs, quack, Gen Z doctors. But if there is no toll-free line, there is no, an average Nigerian family does not have access to first aid. If I fall for ground, you know what to do me. I heard you telling somebody on the phone, turn him to the lateral side. I know, I'll be turning him lateral position, turn him to the side. But if somebody falls on the ground in the house, I'll go leave him flat. Maybe your own tongue will suffocate him. Do you understand? So these things are basic. Hence, I took it all the way down. If somebody wants to study medicine, I don't care how big whoever is on top there and is not comfortable with people coming in. Flood that industry because all over the world there are shortage of doctors. And over the 80,000 doctors that have ever registered as professional doctors in Nigeria, 15,000 plus are abroad.
They don't jack back.
For the remaining ones, quackery, they ask me they talk. So we know say before this December and January, over 2,000 doctors will come up for this country again. And you have the guts to say you are restricting
as me and
what?
You did like these doctors.
Nurses are treated as their cost. No. If you go public hospital, doctors, the way they talk to nurses, as you did bed self, you go pity for the nurse.
True.
Like say a career no follow.
Anyways, I agree with you guys. So it's so easy to put blames on doctors,
but it cuts across everywhere.
It's so easy to put blame on the government. Now, let's talk about individuals, right? You and I. What are the things that we need to do during health emergencies? First aid, right? So we all saw the video of the lady that was caught on social media, that was allowed to bleed. I thought she actually died, but I later realized that she was saved somehow. But it took time, right? So what are the likely first aids that we need to be aware of? It doesn't have to be caught. It could be living healthy. It could be basic CPR. That's what you guys call it, right? What are the things that we need to actually know as individuals? Even the poor masses, what are the things that they need to know about?
Proper sensitization,
the thing is
that we need to do.
They put it in the curriculum from an early age. Put it in the curriculum.
There's something called basic life support, and it's not restricted to healthcare practitioners. Everybody can learn it. Everybody can. Like when it's done in my hospital, up from the security guys at the gate to the cleaners, they are all taught how to do basic life support because a patient might be coming just into the hospital at the gate there and fall. Do you understand? So you see, the security man trying to resuscitate this patient. A cleaner might just be cleaning the room or around where the doctor is not there, and
So they go through that training.
So yeah.
In his hospital.
No, not just in my hospital, right? Yeah, it's something that because there's someone that goes to different hospitals teaching people how to do basic life support. He's a doctor. Do you understand? He teaches people how to do basic life support. And apart from that, I think because I like I said, I'm privileged to have worked in a private hospital, and when you say public to the low, I've experienced both. So my experience in that place, right? Like I'll tell you, they have one of the best nurses, to be honest. In those those general hospitals, the nurses are well trained because not just hardworking, because the first of all, like I said, manpower is not there, right? So they are hands on. You see these people, they can suture very well, they can take delivery very well, they can do those things that nurses are expected to do. So to address these emergencies, right? It's like for that situation, I would say, I don't want to castigate anybody, but even when you watch cartoons, my nephew that is 9 knows that when someone is bleeding, you just tie it. You put a tourniquet, like just use cloth and tie it. I think everybody knows, but in that situation, you can tell that
everybody does it in Nigeria.
Sorry?
Everybody.
I feel like
in PHC, the only thing they taught us was resuscitation.
No, it's not just PHE. You watch movies
No, I
now.
was
The
going somewhere.
first
You said
reaction
this
when you
Your
just
reaction
caught
is
just
a
in
norm.
time.
movie is in
In time,
Nigerian
yeah.
movie. Abroad, it's mandatory that at different age, even from your
We watch
At
Oyibo
different
movies
age,
now,
They show you
don't we?
different level of first aid when you go fit do. Do you understand? That was why I was saying just now that these things are easy. Doctors, right through your ministry, that the Senate should visit, the Senate and the House of Reps should visit
Are they
curriculum
They don't care now.
adjustments
Let me talk now.
at every level of education. First, just
That
when you
be
say
the
for
negligence.
university.
That
They
should
neg-
not
neg-
wait
neglect the
that
sector.
should not just come from the doctor.
No, listen.
Do you
I was going
understand?
somewhere.
Yeah.
This is not for you. This is not for you to
Upgrade
correct.
of the healthcare system.
That's suggest that they suggest.
Yeah,
Should be an innovation that is coming from the doctors.
No, not really.
Proposing
Not
to the
really,
government.
not really, not
Doctors
really.
are not. Healthcare is broad. There's science,
Yeah,
lab tech.
yeah.
No, I
People
talk
that even
about,
go
I
to
talk about
school
the
of
health.
health.
Yes.
People that go to
yes,
school
I
of
agree
health,
with
if you
you.
go to
Abi?
government hospitals in Delta State, you see that over time, some of them have assisted nurses or matrons in child delivery. You think that they are registered nurses. They take deliveries and those things. Well, like you said, there's a shortage of doctors, but there is a broad range of profession in the medical field, and people can always have like
Actually-
abroad, like in the UK,
Actually,
for
it's not
example, like
just
you can
shortage
start
of
as
doctors.
nurse.
Sorry, shortage of
Healthcare workers. But what I'm saying is, when somebody has the knowledge or is open to learning, just because they don't have the paper backing, doesn't mean that they should not have they can't assist.
They do
I have a
assist.
question.
But what I'm saying is, you said it shouldn't be on the doctor. The masses have their role to play. But you have talked about
In
poverty.
terms of what? In terms of I would
Policy. I'm talking about policies
Okay,
right
yeah,
now.
yeah.
I know that there's a shortage of manpower. I know that bulk of the problem in the healthcare sector is economical. Because these places, they don't have good machines, they don't have power supply. These government hospitals, they do surgery, they open your belly, open your picky, they go seize light. When I gather money buy for it,
Forget
don't worry.
scissors for inside
I know
belly.
that one.
talking about policies. Why do you
But
think
what I'm
doctors are
saying
always
is-
going on strike?
See this thing. Okay, yeah, let's move with the date. With the date. And every time I have something to say, I fake a breakup. A time will come. If I say I'm not they do again, you go do like this. I go come back say I was just angry. What I'm saying is the idea is what is more important than the road we're traveling is the destination when it comes to healthcare. We want to get to a place where there is minimum casualties when it comes to healthcare. People should the mortality rates, infant and maternal in Nigeria is absurd. Quick one. Somebody say they do Yahoo. Now all these Yahoo boys they talk. So like I can't tell you my maga say my wife died during childbirth. They asked me whether the wife gave birth in Nigeria. Do you understand?
That one now will be the biggest challenge now.
But what I'm saying is these policies can be pay attention to what they are. If the Association of Medicine or whatever can pay attention to what the masses are complaining about online,
And face
that
it.
can inform a petition or a request to say if from KG, all these private Montessori schools now, because it's not Nigerian curriculum, they do it. There is first aid. If somebody is hot, just make sure they are lying down properly and call a doctor. That's what they tell the smaller one. Primary 6, JS1, JS2, they can tell you, put them on this position. But what I'm saying is, first aid and quick response or whatever is not tied to the profession, to a particular profession. Everybody should have a basic knowledge. I learned in Girls Guide and Red Cross, but nowadays children they don't do these things anymore. So these things can come through school.
Even through the Nollywood
Well, I think that should be passed.
It's not the Adam
Wait,
Joy
They can
like I said,
sponsor movies
wait,
for
like I
things
said,
that.
like I said just now, that can be passed. That's where the government comes in, yeah. Because like I said, there's someone that have come to different hospitals to teach, first aid and all that. Why the doctors? Like I'm sure these guys will write proposals to FCD, what's it called,
Ministry
and
to
National
do
Board. But I don't want to call it the corruption up there. That's one. Then number two, currently they adjusted all budget for every other segment apart
they
from
cut
health.
health, yeah.
So can you see the problem? First of all, I'm working. Do you know what? I was telling someone yesterday. If I'm japping today, with all due respect,
Yeah, I'm not gonna see you next.
if I'm japping today, the money is not top on my list.
What's on your list?
Money is like
Quality of life,
number
really.
5 on my list.
what do you mean?
Number 1 is when you become a doctor, it's just like, except you don't love what you do. Like a lawyer, if you win a case, how you they feel? Forget the money where they're gonna give you. When you win a case, you feel good with yourself.
Yeah.
If you're a policeman,
fulfilled.
okay, no, you're a comedian. You go and you
policeman,
kill
no
it.
use
wait now, and you go and you
policeman.
crack this. Everybody they shout, they throw him. Guy, you won't even talk. You're not moved about the money at that point.
They shut down the whole place.
How you take shut down? That's how it works for me. If, like for me as a gynecologist, I've met a woman that she was not able to conceive for more than 7 years. 3 failed IVF. I gave her just what they call ovulation induction. Boom, this woman get belle. I do antenatal for this woman. We take the delivery. See, the child is a year plus. Anytime you say see your baby,
goosebumps. Ooh.
You saw it here.
Yeah.
Just for you to know how passionate
Actually,
it is.
goosebumps.
That's what I'm trying to let you know that.
Okay, we'll
it's
take
not-
it easy on
if
you,
I'm
we'll take it
going,
easy on
if I'm
waiting, ovulation waiting.
forget that one, not be your part.
Wait,
So what I'm trying to say,
No mind that.
ovulation.
so what I'm trying to say is that what we love to see is
Success rate in your
success rate. There's nothing that gives you more joy.
Not
To
be
be
all of
honest,
now.
majority
Not
of
all of
us.
now.
Listen,
So they talk
Over
true.
time, even though you
They
not
talk
be like
true,
that,
not be all of
even
now.
though you not be like that,
I don't mean doctors
wait
don't
now.
send your
Wait,
papa.
no,
Like that
no,
ban,
I'm
that
going
money.
somewhere. I'm going somewhere. Even though you're not like that, over time you start being like that. You know, they say that money not day for this place. So
it's humanitarian.
it not day.
Money no dey
See,
Nigerian
they don't
medicine.
pay you shit as a doctor.
But what
Do you
I'm
know
saying,
what
you
they
people
pay?
are not speaking up in the right
Wait
direction.
now, that's what I'm going to. Do you know
No,
why?
yeah,
Do you know? Wait
Yeah.
now, wait. Before we go into strike, it's just like ASU and everything. Do you think there are no meetings? You just be like, say, like you said if we're in a relationship and I'm not liking something, I'll just break. Do you know how many times I would have called you and be like, babe, this relationship is toxic. The basic things are not there. You don't care about me. You are not doing the things I like. And you'll be like, I beg, now relationship, this guy, I know say this guy not fit break up with me because I'm too beautiful. He cannot get anybody as hot as me. That is what the government feels. Like, where will they go? And I keep telling you, babe, this thing is toxic. Babe, I'm not like waiting there.
When I'm not for organized protest.
Wait,
come outside.
No,
If I hear say medical
they
board,
do
I mean medical-
what they do is this. They give a warning strike. Like, babe, I'll tell you, say, babe, as this thing they be like this, or it be like, say, I will give you space. Oh, I will give you space. You'll be like, get out. Give me space if you want to give me space. We don't just jump into strike. True of us.
Why
you
be
see
say-
3 days warning strike. And
Why
when
be
we are
say-
do
striking,
international
why be say-
petition, make them not defeat they go abroad for treatment. So
that
that
is not in our
How many answer this
power.
question?
We would love to
Why
do
be say
it.
if
media,
doctors go
social
on strike?
media.
Why be say if doctors go on strike? Let's say for example, other people want strike for this country. You could say everybody could all join them. Why be say if
Una
doctors
so
they
dey
go
do
on
una
strike?
thing by una sef.
They go be on their team.
Una dey see una dey
We
do
don't
like
join them
this.
because
Una should have
here
passed
they
too
dey
high.
put themselves where we dey. Doctor
telling
don't get
you.
one kind
No,
of
no,
pride.
it's not- it's
They
not-
don't do their strike.
not
They'll
about-
call up the side. We don't even know.
Wait, it's not about
They do their
part.
thing.
No, it's not about part.
Make it our team.
Wait, there's an
hold on.
association.
Yeah, exactly. There's
You
an
don't. There's an
association.
association.
Your
It's not
association is
NLC.
So
see.
why una no fit do strike?
Wait,
Na
wait.
the head concern us
So
now.
we can't say if we dey go on strike, make police not work.
Give us
Make
no,
this not
give
work.
us
Papi,
reason
Papi,
that.
wait,
Give
Papi,
us no, give us reason that.
Don't.
Give us reason that. Okay, fine, bro. We are going on strike because the government is not doing this that will affect
No,
you.
not even that one too far.
No, na join up. We'll fight
How
this thing.
many associations they go on strike where everybody join them apart from NLC?
Hold up. You
When
know
ASU
why?
they go
You
on
know-
strike, health they
hold
go on
up,
strike.
Of course,
I
They
might tell you
don't.
No.
now.
no.
It's an
What they do-
association.
What they do is sympathy strike.
It's exactly.
So if teachers are on strike, doctors can say
It's
let's
not.
go
It's
sympathy
not you
strike.
people that want to join
oh,
us.
yeah,
We
wait.
cannot
They
mandate
don't
you to
tell us
join
to
us.
make us join you now.
See,
We can't
Papi,
mandate
wait.
you
So
to
they
join
operate like a
us.
We are
separate
looking-
body, individual body. We go.
No, we are looking
Now,
for a
now-
solution.
Like-
No,
No,
they said to the
No,
fight
we
for.
usually say it.
No.
We usually say it. It's there if you look at it. First of all, what we cry about is we don't like the state we are working.
Now they always cry
wait,
about
We
our
no,
cry.
money.
No,
They never cry about the
no,
system.
guy. You're getting
They
it
cry,
wrong.
not the
We
system.
always cry about the state. Guy, if I tell you what we they go through, Baba, if you read your book here, maybe they'll say to treat this patient, option A, option B, option C, option D.
No equipment
They'll say
for
if
all the
option A
options.
not there, you do option B. If option B not there, you do option C. Do you understand? We're starting from option D. You be native doctor.
That one will weak me. You be native doctor.
How you want to do
yeah,
am?
wait, Dr.
You,
Roy.
you can't give what you don't have.
Dr. Roy, I was
Simple.
trying to explain something.
But una dey-
Let's
una dey-
use this
una-
Peter.
but
Let's
una-
use this
una-
Peter.
Guy, we
Una-
dey improvise.
Una
Oh.
never try to collaborate with native doctors.
Now, now they even go see. Two
We'll rather.
They don't see it. They don't see their finish
Listen,
now.
Collaboration.
Mr.
Partnership.
Chu, talk that word. We'd rather do what?
No, we'll rather collaborate with the greatest of them all. Not be native
Make I
doctor.
explain this thing when
Na
it's up.
Jehovah
Why
na
this
dey
thing
do
are
am.
BS?
Native doctor dey of two
Let me
type.
tell
oh.
you.
Wait.
Let me tell you. My granddad died 3 weeks ago.
Oh, sorry to
If
hear
you can
about
come to
that.
the burial, I would like you to come and hear what people will say about him. He's a healer. Maybe that's why I got my whole babalawo concussion thing going. But I don't prescribe. Right? That man has helped people with breast cancer. Local herbs on the street. The methods are not great. This is what I'm saying. Like we say, this is how things are. Like things are set in stone. Right? In India, in China, they've looked for a way to merge both their traditional practice with medical. But you see Nigerian doctors, you just be like, your papa, if your papa wants to when you small say, I want you to be a doctor, they carry shoulder up.
Right
say,
from
make I forget picking will be doctor. That cultural thing of this is like the highest profession in the land.
Pride go enter the matter.
It's their background, number one. Number two, this collaboration, I say, we rather go for the eyes. This collaboration, lack of collaboration syndrome, they worry now for other aspects.
We won't collaborate.
Obvious. Excuse me. See, social media is a powerful tool in this country. Whether you like it or not, every
I won't collaborate, man.
Nobody said they can't collaborate.
I was just by the way now I said Jehovah.
Forget all their medications were gotten from plants.
No, now let me tell you the difference with that.
No, I was going somewhere. Finish.
There's
Please don't let me drop my mic.
Okay,
my
sorry.
time so that I will just wrap up. Number one. Number two, social media is a big thing. It's a big deal. When I said you can do a campaign, a petition, and all that, you can do it through. In fact, the association can fund it through anonymous source, but it can be on social media in a way that everybody is signing that this for healthcare. Have a proper press conference.
Exactly.
Sit down. This is what we're. I don't know what happened for this industry, but this is what we are going through. And if you have ever been in a surgery and this happened, it is because this is not in place. That is not in place. So we are calling on you for support for a strike.
Now tell you to talk down.
You guys have actually never done that.
If you have done me, I go put this my shoe like this.
Follow now.
I will come outside because I lost my only brother. I lost my other brother to misdiagnosis.
That's a smoky boo.
When I not get machine, when I not go feel run test, you don't see their X-ray. You don't see the X-ray machine.
She's already. That means
carry my wife go for.
Carry
my wife go for. What do they call her? Carry my wife go for. What do they call her? Make she go. They go check her. This thing. The guy just carry that. They press.
Let me tell you something. Let me tell you something. Yeah. The mindset of an average Nigerian feels the problem is the doctor, not the government.
We know it's the government. We still
no. I'm telling you.
We go follow and fight.
I'm telling you. Nobody. I've not seen on social media where someone is like, my mama died because it be like say that hospital not get this thing, not get out. The first thing you're gonna hear is negligence. Doctor Nike, my mama.
How many times you don't hear Tinubu come power? Naturally, they will call the man who holds the pen. Who holds the pen in the office?
No, apart from
it's
that,
natural.
no. Apart from that, generally, we insult government. But when it comes to doctor,
we insult people and not talk about
it's okay. You people insult. We are used to it. We're already used to it because that's what people do on a norm. But I'm trying to let you guys know that if you're even going to allocate the problem of the doctor not even reach 10%.
We know they pass them. We the same one that call for help.
The problem of this healthcare system is more of the government. Now, let me even talk about this insurance scheme, National Health Insurance Scheme. That was where you started from, right? In what was it called? There's an insurance scheme working in Nigeria.
Oh
my God!
Now
should I? Let me boss. Let me. I work. Let me tell you.
If you know how much.
Wait. My hospital here. To see me, my consultation, guy, is nothing less than 20K. If I want to diagnose, just make I follow you talk, say,
20K I paid last week.
To see me na 20K, forget investigations and everything.
It's just a bad money.
I'm going, what's 20K in your country, I beg? I'm going somewhere, right? But NHIS, to see me under NHIS, guess how much? 750 naira. That's how much subsidized
how go access this and NHIS?
No, it didn't. Plenty. National Insurance Scheme. Now, there's the private and there's the national one. So wherever they work, right? If you did any ministry where, masses they work, those people will be say, if they did ministry, your ministry most times have an affiliation, like a body. Like for example now, there are some private insurance like Mansard and the rest. So your NHI is probably the affiliation with one of them. Mm-hmm. So what those people do is like they'll just come your office. Maybe every month they take 2K.
Who not get job?
Wait. I address them one by one now. So you have to be affiliated to something. So those people will be say that they work. Those people will be say that they work for ministry, right? You can come to your door. They collect like maybe 2K, 1.5 every month. So when you sick, even rich men will know NHIS. I want to tell you the secret that they use NHIS. This man account go get over 100 million, but still they do NHIS. Mm-hmm. But you will see them that when you are treating them, they are under NHIS. But if you see the room where they stay, now 120K per night for hospital. Do you understand? So you that is like okay, maybe private sectors. Private sectors also liaise with these boards. These boards are the connection between the hospital and the association and the
for
your this
second
thing.
class
No, then wait now for the poor man. You can
now.
they listen to Mansard for radio. They go say Mansard. You go meet Mansard. Tell them say
from where we go meet them.
It did now. They
No,
do
we want
the
people
jingle.
to
Wait now. They do the jingle for
Hold
radio,
on.
right?
We don't get radio.
Wait
How
now.
would they
Wait.
know?
Hold
Relax
on.
now,
How will you say you
relax.
don't have radio?
Wait
As
now.
a poor man where they live for village, we don't get radio. We don't get light. We don't get anything.
Wait.
No, nah.
Hold on, let me tell you. Okay, let me educate you.
Okay, just
Let me
let me
speak to
Just
you.
tell me how we
So
can
that-
access them. I
so
want
that-
now to
so
try
that-
know.
So that you, as the voice of the poor masses, you
You
can
go
go
tell
and
your
tell
people for
your
village.
people
Uh-huh.
how they do them. Your local government has information about NHIS.
Okay.
Yes.
The nearest local
Healthcare
government,
center.
healthcare center,
Yes.
nearest local government, nearest healthcare center in your community have those information.
Secretariat,
Okay.
tell
Go to
them.
the secretariat, approach them and ask these questions.
Okay.
For those that have radio and smartphone, they can make use with Google. You can listen to health correspondence and all of that, right?
Okay.
But to wrap all of this up, let's have a solution-based discussion. Right?
Okay.
For me, I would like to ask, what are the ways that we think we can advise either the government, the stakeholders that we have identified in this conversation, the government, the doctors, and the poor masses. I don't want to use poor
Very
masses.
important.
Individuals, general masses, how can we all come together in harmony to better the healthcare system? Let me talk first about what I think the individuals should be. I believe that, first of all,
Be responsible for your health.
problem of Nigeria, apart from being responsible for your health, problem of Nigeria is wholly hinged on mindset reorientation. People need to know and be conscious about their health. They need to know the right hospital, the right place, the rules, the laws that are in place as regards healthcare system. Understand that you need to approach, if you don't have money, you are poor, you need to assess NHIS, the health insurance scheme. You need to find a way to align with some policies of government that are beneficial to you.
You don't have to be poor. As a citizen, it's your
As
right.
a citizen, it's your right to assess some of those
Because it's just
policies.
5% of Nigerians are registered.
Yeah.
And half of that 5% don't even know what
Yeah,
NHIS
so
does.
people need to understand that some of this we know that the government has a lot of shortcomings, no doubt. With they haven't come forth with health in Nigeria, so to speak, because I mean public hospitals are nothing to write home about, right? But the little structure in place, let's find a way to
Optimize it.
right? Assess it, speak to you,
And we'll be
speak to the
gentle.
masses.
Gentle with
No,
them.
Speak to the poor masses.
like
and let's optimize some of those
addressing this thing is going
policies.
to cut across from the masses to the doctors to the government. That is, I'm going to profile my what I
Yes,
think
yes.
is, first of all, let me talk about the masses. Me, you, well, all masses, right? First of all, how much do you want to know about your health? Like, go outside of your comfort zone to know about it's your life. Do you understand? It's not, I cannot do it for you all the time. The doctor cannot do it for you all the time. Go ahead. Like, I've seen people come to the hospital and they'll just be like, I just came for screening. Human papilloma virus, just do all those things and get vaccines on your own. You don't need anybody to preach it for you. Then secondly, I think, the poor masses also have to work on self-medication.
poor masses.
I'm just using his
Poor-
words.
poor and ignorant
Or
masses.
yeah, more of like the ignorant masses. We do a lot of self-medication. There are a lot of quacks, pharmacies, and these drugs. You don't even know the potency. You don't even know if they have expired. You don't. We just get it, and you might be destroying your kidney and your liver. Then, lastly, like I said, we tend. I'll put myself as well because we're all masses. We tend to want to seek health care very late. I've seen so many people until the patient it don't read before they decide to come. Then at that point, what do you really want the doctor to do? Knowing very well that we not even get enough.
And you know be
They
babalawo.
will not be babalawo. Then you just expect a miracle. So I feel the masses on their own should try and seek health care as soon as possible. Then again, I like faith. I'm a Christian. I'm from church. I dey come, but faith without work, my brother, are nothing. Do you understand? Even God that made us doctor and gave us the knowledge is to help. You understand? So we should cut down on this our belief. I believe in miracles, but I believe that a doctor will treat me and I will get well. I don't believe that I will stay in my house and God will send his angel and heal me. That I don't believe in that. So I feel these are where the masses will come from. Then for the doctors, apart from the I know you want to hear this one a lot. Apart from the manpower and all that and the negligence, I think what we can do, you pose words. What we can do is, I think there should be more awareness, right?
Very well.
Yeah,
And
there
training.
should be more awareness. Telling the people what they need to do. We should. And apart from that, we have empathy. As an average doctor, you're expected to have empathy, right? And again, I think
they really have
I think sometimes there's also miscommunication. That's my power. Like I God don't bless me the way I be. Do you understand? I just feel like there's nobody I can in not girl you be. If there's a way I will talk to you, you will listen to me. I'm not arrogant. First of all, I'm coming with empathy. Like just now when you say you lost your dad, the first thing that came out from my mouth was sorry about that. Do you understand? So ideally, you should want to, because these people are, and there's one thing my MD used to say, nobody wants to come to the hospital. People don't like hospital. Do you understand? So the fact that you have someone in the hospital, communicate. Rapport and communication is the first mode of management. When I'm explaining and carrying you along, at the end of the day, you won't come and start saying negligence. Then again, I wish the government reviews these policies of injured, like that girl's zone. I felt bad because this one chance thing, to be honest, it has happened to three doctors in my hospital. They don't have cars. One,
That's not get motor.
they pay well. These are three doctors that don't have cars, like three, and they were all women. One was two doctors and one lab scientist. The lab scientist was so bad that she could not see.
It's not her face.
They punched her face and everything. Her eyes were like she could not see. So I just want to tell you how bad this, especially in this Abuja, this one chance thing is very, very. It has happened to. If it has not happened to your friend, you know someone it has happened to.
Of
Yeah.
course.
Or someone. So to show how rampant it is. So for that situation, I feel like it should be properly investigated, and no doctor in his right senses whatsoever should as in how do you sleep at night if you cannot attend to a patient first?
They
At
get
least let me
conscious.
tell you something. A patient comes to you, I might not do the broad treatment,
First aid.
but that's what we preach in my hospital from the beginning. Our government, they should equip our hospital.
Anyway, yes, you've made your point validly. Sonia, please, can we
So
hear?
for this, I put down a few things so that I don't get carried away. So I think we should look into the private sector. They're not so bad, really. And with schemes on ground like the NHS and people who have health insurance or some form of assistance, they should be able to access. We don't have to overpressure the public sector. And I asked someone a question during one of our one-on-one session, and I said, growing up, did you know Nigerian healthcare was poor? The healthcare system was poor? No, because people were largely responsible for what they ate. We had a very active life. So now, from quick fixes to sitting down all day, people are now more susceptible to ailments than before. So access, if you can, access the private sector. Then we should also look into private-public partnership. They did that with secondary school hostels, boarding house.
So native doctors should partner with
No.
doctors.
What I mean is, philanthropy is not all about giving clothes and food and snapping pictures. You can literally fund your local healthcare. There's no use giving people 50 bags of rice for Christmas when that same money will help you set up their lab sector in your community.
But you need to eat first now.
If you eat finish now,
Stomach
stomach
infrastructure.
infrastructure. And like he said, we need to be careful with prescription. I think it was during my diagnosis last week, I heard that I went to the pharmacy, there was no paracetamol. So the guy gave me ibuprofen. Apparently, ibuprofen caused my ulcer. And again, the quackery he was talking about, right? But we should look into private-public partnership in a way that the hospital have access to 60-70% of the funding. That is what they do in these developed countries, right? Because if all the money is going into the government, like he said, budget is not friendly and getting it back is a problem. They are generating a lot of revenue. So if there is a 70-30, they are running the things, they are buying the machines that they know are priority for them. They're setting the place up in a way that their staffs can go for trainings, because many of them don't do follow-up trainings. But they can go for trainings,
relearn and keep relearning.
Then I also feel like when it comes to awareness, these private hospitals need to have some form of CSR as it concerns education. Some doctors are going to a doctor is going to hospitals to train hospital staffs, non-medical staffs on first aid. Hospitals also can come up with a scheme, personal private sector now, they can come up with a scheme where they train the schools in their locality on healthcare. This thing is not rocket science. Everything does not need to come from the top.
Right.
And everything does not need to go there, right? And whether we like it or not, our healthcare is in a crisis. More than try to call for help. Worst case, we go help on a retweet, we go drag, we go sign petition. Social media is a big tool. I just feel like the healthcare system
when next we strike,
filled with
archaic.
No, we're not. You call us before the strike.
Join.
Do a press conference to say, Alpha, we won't go on strike.
Give
us ample time. We're going on strike. If you have an emergency, come and take your first aid, because for the next 21st to 28th, then we will go follow and come out.
Anyways, yes, I agree. Good idea. Let us quickly round up. Papi, voice of the masses.
So myself, I put some things down. You understand? So like the solution what they talk about.
Yes.
So to ensure they made them make sure say people will get access, all community will get access to this healthcare. Because access now one thing, people for the grassroots they hardly get this access to proper healthcare system.
Both in knowledge and
yes, both in knowledge, sensitize these people. There should be proper sensitization for both the masses and both these nurses where they neglect important cases. They chop rice. Person will carry emergency call you they chop. Make them sensitize these nurses. Make them get value for life, because those ones, the doctor fit get sympathy but you see that nurse wey dem no dey pay well, na be the problem. Oga abeg, na you put me for here, abeg, how much they even pay me sef? Carry your case go one side, when the reach your turn we will call you. There should be proper value on emergencies. Make dem understand wetin they call emergency, because like say we no know wetin they call emergency for this country.
Right, thank you.
You understand?
Thank you.
Emergency, they don't know when emergency comes, they look at like saying I want play. Emergency, fast forward, sharp, 3 times. and again, they should make sure say we need a health system we go respond to unique desires. These communities they get desires. They know as in you need to respond.
Apart from health challenges or personal
needs.
You don't understand about personal needs.
No. I talk about in terms of health.
Okay.
They get low response. Imagine somebody from because of the lack of response, somebody from village go they come Abuja. Somebody from you go leave General Hospital, go come Abuja, come they for show treatment. Because the response there they low. They say doctor no day. You go there, no response. 3 days, 4 days they go hospital.
Sometimes they don't even have the facility.
5 days they go hospital for one case.
Yeah.
The person will come carry sickness, travel.
Die for boss.
Sometimes you go die for boss. Go they find Abba. More than self get
confused. Now government go come in.
Well, thank you guys.
We're gonna support you now. No worry.
Thank you guys for this healthy conversation. It is established already that healthcare challenges globally is a concern. You know, it's just that Nigeria has been we've not been forthcoming, especially from the government and the public sector, private sector point of view to this challenge. So we've been talking about ways to better some of these challenges that we have identified, from grassroots to state level to federal level to the government at the local governments, you know, for masses, primary healthcare centers, for masses to understand that there should be a nexus between you at the local government and your primary healthcare center. Go there and get information about your health. Go there.
It's all right.
Yeah, it's all right. There are insurance policies out there that will better the lives of individuals, and we too as individuals, we should be health conscious. Very. You know, like you just said, by the time I clock 40, I already plan to start the whole prostate test screening, and all of that screening. It's good because when detected. No, it's for guys.
So for women,
Yeah.
boobs is 35.
Boobs, yes.
And you do your first mammogram.
Yeah.
Yes,
35.
yeah, and before you clock 35, maybe we can help ladies to be checking their boobs too.
Just
You can still by yourself at a raise your
well,
hand.
You can check your wife.
But for-
yeah,
boobs.
you can even teach them how to
Teach,
do
no,
it.
me, I like to be the
You
one
can
to
even
check.
teach- no,
I don't want
because-
to teach anybody.
Because the woman, while she's
Sorry,
taking
guy,
her bath, she can even
In front
look-
of your mirror, like you can
yeah,
just
you
look.
can
Is
do
it?
that.
Yeah.
But
Balance.
apart from that, generally, even what's your BP? What's your blood
Yeah,
sugar?
BP, as low as
Is it-
BP, blood
that-
sugar.
No, as an adult,
and
you are having
everything.
headache every other day.
Like
This
in
is
this
normal.
country,
So we're wrapping up. I know conversations will go on
We
and
get
on
back to
and
it.
on
It's
and
because
on
matter
and
plenty,
on and on. So we appreciate the conversations. We appreciate the good work that BIGAiD Foundation is doing to ensure conscious, healthy living for everyone. Like they say, they want to approach health one goal, one mission. Good health system for everyone. So we thank you guys for coming to this podcast. We'll be having a series of these conversations that will spark advocacy, that will spark genuine results from the
And
government,
interest
because
in the masses.
an interest, because talk, and without action is nothing. For me, we always want to be very sustainable in what we're doing, so that at the end of the day we'll have reasonable results. So thank you guys very much for coming for this podcast. My name is Chuk Sayandban, and Dr. Roy, we appreciate you.
Thank you.
Sonia, we appreciate you.
Thank you.
MC Papi, the voice of the masses.
I will
Thank you
take
very
the
much.
message.
Don't want peace. You want trouble always.
I'll take the best about
Thank you guys.